Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we'll talk about the recent rumblings and rumors about new CDC guidance about COVID isolation. But as usual, we have a few news updates.
Let's get into it.
So first, we have that more than 2 million people have been dropped from Medicaid in Texas. That's a lot of people.
That is quite a lot of people, yeah. So that's unfortunate. Folks who had Medicaid and able to obtain medications, able to visit doctors as a result of being on Medicaid. We've talked about this in the past. There were pandemic policies that expanded Medicaid coverage, and many of those were lifted at the end of the emergency, so people are getting dropped from the Medicaid rolls.
And the 2 million in Texas is actually the most out of any state losing coverage in a year. And just to put things in perspective, Houston's population is 2.3 million. So that's basically like an entire city losing coverage.
Yeah, well, in Texas, they go big.
Yeah.
That's how they roll down in Texas. So not surprised that it's the most of any state losing coverage. It's a large state, but yeah, it's quite a number. And, hopefully the folks who have lost coverage are able to find some affordable plans through the exchanges or other means.
And just something really unfortunate in all of this, like over half of the people that were disenrolled was because of procedural issues, like failing to return paperwork. It wasn't always necessarily because they were ineligible. Like some people, like you said, lost it because of the end of the emergency, but others, they didn't get the notification. And it's such a shame to lose coverage over something like that.
My gosh. So over 1 million people in the state of Texas have lost health care coverage due to procedural issues. And now 1 million people no longer have health insurance.
Especially in a digital age like 2024, how are we not making it simpler for people to renew their Medicaid?
Totally. We got to look into that more. Let's go down to Texas and figure out what's going on. That's not right. That's all I can say. I wish I had more.
Same, I wish I had more too. But I do have more news. We have a quick poll. So we did a quick poll on clinical trials and, just a little bit of background on clinical trials. They help researchers study the safety of new medical tests, devices, and treatments and their effects on people. Clinical trials, of course, you can opt into them. You can decide to join, and there's different rules for each one. But we really want to know, what our chronic illness community is thinking about clinical trials. So we did a quick poll with our patient support program. And are you ready for the results?
I'm ready.
So a little over 2,000 people responded, and 68% said that they had not participated in a clinical trial.
Wow, I'm actually surprised how many have. So just by the reverse of that, 32% have participated. So almost a third. Interesting.
I know, that surprised me too. Have you ever talked to your doctor about clinical trials or been offered one?
No. Nor do I. Frankly, I don't know anyone personally who's ever done a clinical trial or been asked about it.
Same for me. So in the poll, we asked what are the most common reasons that people have not participated. And like us, 55% said they never received information, 28% said they were never eligible, and 20% worried about a medical issue or side effects from a new medication or treatment with the trial.
Wow. What would help make people feel more interested, for example?
So, yeah, we asked that too, and people were able to select all that apply. Some of the most common answers, 70% said knowing the risks of the side effects or medical issues. 68% said knowing more about the medication or treatment. 63% said knowing how the trial will affect my current treatment plan. 55% said knowing that my doctor supports it. And another popular one, 53% said knowing the time commitment.
Wow. Again, I'm surprised. 55% knowing the doctor supports it. For me, I feel like just on a personal level, my doctor says something, I'm like, yeah, okay. As long as she's behind it or he's behind it.
I know, 100% I want to know my doctor's supporting it.
Yeah. I'm like, all right, the doc's in, I'm in.
Yeah.
Let's do it.
I know. I'm like, I don't want to do it unless my doctor's involved in it.
Totally. And supports it. If the doctor's like, well, I don't know about this, I'm like, all right, that's it. I'm done.
But yeah, these are some good things to think about, like questions to ask your doctor or, if you're thinking about a clinical trial, just I thought those were great points.
Totally.
How is it going to affect your current treatment plan? What does your doctor think? What's the time commitment? Like all great questions about clinical trials.
Yeah, absolutely. Thanks to our team for putting those together. All right, well, let's talk about this new potential, shall we say, CDC isolation guidance. Last week, the Washington Post released a story that the CDC is considering replacing the COVID 5-day isolation period guidance with, quote, staying home until 24 hours fever-free and improving symptoms, end quote, as the isolation guidance.
So this has not come out yet, which is so confusing. I've seen so many articles on this, and for a minute I thought the guidance was changed, but
Right.
this is just a leak, and we don't really know what the CDC is thinking. Like they haven't made any comment, right?
No, they have not commented. You really have to get to the second paragraph in these articles to even know that it was a leak and not an official statement from the CDC. But yeah, someone leaked this to the Washington Post. So, let's talk about things that we know about COVID. So first and foremost, if you're contagious, you're contagious. That's not changing. And certainly the CDC knows that. If you're infected, you still spread COVID-19 to others for as long as 12 days even. So regardless of whether there's a change in protocol or not, it's important to be safe and also to protect others. If you have COVID and find yourself going out there, make sure you mask up to protect others.
And just thinking about getting COVID testing, like testing is not what it used to be. Like
Right.
I don't think we've gotten a free set of tests since the summer, maybe. I can't even remember. So that just says how long ago it was. And it's kind of expensive. Like, yeah, they cost like $30. Like, if you're worried, it's not just easy to be like, let me just do a test to do a test. Like, it adds up.
Right. There was a time when it was so easy to hoard tests. Anytime you had a sniffle or a scratchy throat, you could just start swabbing yourself. And then if you did eventually test positive, you're like, all right, now I know and I could stay home. With the cost of tests rising and their accessibility and not quite as prevalent, it's highly likely, I don't have any facts to back this up, but I'm sure it is the case that many fewer Americans have home tests, and those that do have fewer sets of home tests available. So they're more valuable and they're less likely to use them quite as often. So as a result, you're more likely to get people perhaps experiencing early symptoms such as feel that it's a cold or something not to be worried about, when in fact it is COVID and are still going out there.
Also, this is just a little aside, but I wanted to take a test recently and it was so confusing to find the expiration date on the box. Like, I couldn't understand when it was shipped out or if that was the expiration. The timing wasn't adding up. It wasn't so clear. And I just think we need clear labeling on these boxes too.
Yeah, that's a great point.
And I was like, oh, do I just throw this out and buy a new one? And it's so expensive. But obviously, like, we know the importance of testing and making sure you're not contagious. So
Yeah.
it's like, I guess I'll be safe and get the new test.
Another factor, the number of paid sick days for Americans is abysmal. Only 23% of Americans have zero paid sick leave. And among those who do have it, the average American has only 10 days of paid sick.
Yeah, this is terrible. You could use like the 10 sick days in one go, like from one illness.
Absolutely. With COVID, yeah, for sure. Especially if you have a pre-existing condition, such as an autoimmune condition.
For sure. I mean, also just like sick days, you may have to take them for your kid. You may not be sick, your kid may be sick, or let's say it runs through your family, like your kid's sick, then you're sick. 10 days is just simply not enough. Aside from like the personal impact of how challenging it is to work when you're sick, like we talk about it all the time, it's just really not cool to go out knowing that you're sick and contagious and spreading it to people.
It's totally not cool. Yeah. And, you may think, this doesn't affect me. I don't know. I work from home or I don't really care. But the truth is it affects everyone. Like you may think it doesn't affect you until, your waiter at your fancy steakhouse that you go to shows up with flu symptoms and he's spreading his germs to you and your loved one over there. It affects us all when people go to work that are ill.
Yeah. Well, let's talk about, I don't know, it's like the state of COVID generally. Like we're not in this emergency. We're not really calling it a pandemic anymore, but it still feels like more of a threat than the flu to me.
For sure.
Maybe that's like a little bit of the trauma that we've lived the past few years.
Yeah. Well, we don't know. We still, we still don't know the long-term effects. There's still long COVID, which is a whole separate discussion that we don't need to get into. This virus has only been around for 5 years now, 4.5 years.
So let's look at the numbers a little bit. Like hospitalizations are going down, which is good. According to the CDC, emergency department visits were down 11% in the most recent week, and hospitalizations were down 10%, deaths down 6%. All that's like really great to see, especially during this winter time. But on the flip side, like vaccine rates are also really lagging. Only 17% of the total US population received the updated booster, and this is compared to the 69% of the the total US population had finished their primary series. So it's like there's a huge group of people that got the first vaccine and now just aren't getting the boosters.
Yeah, I know. We need Travis Kelce to do another commercial for that one because those numbers are, I was going to say abysmal. I already used that word today, but those numbers are pretty poor.
Maybe we need him and Taylor together getting their boosters.
Well, that's like too much firepower. Let's hold back on that for something, Next time we need to go inside, she'll be the one to tell us. She's the only one Americans will listen to. And like I said, I mentioned long COVID, but there's still a lot to learn. The Biden administration has dedicated an additional $515 million to a major initiative to study long COVID, which is a nice increase. The NIH said that the funding would be used to test additional treatments in clinical trials to study the effects on each part of the body. So hopefully we'll learn more about long COVID, but right now it's still like, we still don't know. Like you said, COVID should be scary, not freak out scary, but I think it's definitely a higher plane of scariness than the flu, right?
I think so.
Yeah.
And I mean, our community who lives with chronic illness definitely feels the seriousness of all of it, like COVID, flu, RSV. But I think there's something unique about COVID in that, exactly what we're saying, we don't have a lot of the answers. There's a lot we don't know. And the guidance has been changing a lot. Whereas something like the flu, we've had guidance in place that we're accustomed to.
Right.
And whenever we hear a new thing for COVID, it's a little bit of wait, what? And then now the CDC hasn't in recent months given guidance specific to immunocompromised people. So it's also a little challenging when general guidance comes out and people who are immunocompromised because of their condition or the medications they take don't really know how applicable it is to them.
Yeah, no, absolutely. Absolutely. And not to compare flu and COVID again, but flu's been around for 100 years. That's very different. And flu is seasonal. So you kind of know, when to expect it, when to ramp up your personal safety procedures, if nothing else. But getting back to the guidance. So some of the things about the guidance, the leaked guidance, if you will, that we don't know is number one, masks. If they're going to change the guidance or, make it less restrictive, if you will, is there going to be new masking guidance to go along with that? I mean, if folks are going to return to action while still contagious with this, is the CDC also going to recommend that they at least mask for that period?
Yeah, and I just don't know what the likelihood of people masking is, honestly.
Right. I guess that's not going to happen. And then the other thing you mentioned, the immunocompromised and also elderly folks, is there anything special for these folks? How are you going to protect immunocompromised individuals if more folks are walking around while contagious?
I also saw rumblings that I don't know if this is true or not, but there is a meeting on February 28th where the CDC is expected to talk about COVID shots. So maybe we'll get information then. But I saw rumblings that the CDC is considering another updated COVID vaccine, like this 2023-2024 shot, to recommend another shot of that for people who are immunocompromised this spring.
Wow. And then, of course, there are the big issues. Does any of this actually even matter? How many people look to the CDC guidance and say, okay, that's what I'm going to follow? So is this going to really impact transmission rates?
I have this feeling that no. I feel like the general public has just moved on. We talk about that a lot. And they've moved on and they make decisions based on how they feel. And then our community, what we just said, doesn't feel so included in the guidance. So while we want to look to the CDC and follow, it also feels like it's missing a little bit.
Yeah, no, absolutely. Anecdotally, I find that people use the CDC as a way to get back to work or send their kids back to school quicker. They'll say, oh, we had our 5 days. That's what the CDC says. So I'm good to get back to work. So if the CDC shortens that, I get the sense that some of these folks who quote unquote, rely on the CDC for allowing them to get back into the world, if anything, use this. And I know this is a small subset of people who actually pay attention to this stuff, but it'll be used as their excuse to get back even sooner. Oh, no, there's no 5 days anymore. I'm fine. So I'm okay to get back. That's what the CDC said.
Kind of crazy. I know people that, I just remember this. I can't believe I didn't think about it earlier when we were talking about the sick leave, but I know people that have said to their work, oh, I have COVID. And they're like, okay, so just throw on a mask and come in.
Wow.
Which is just crazy to be that careless with it. I just can't believe that.
Wow. I don't know what to say.
By the way, also, we're talking about with immunocompromised, it's we're at risk for more severe illness, many people who are immunocompromised. But a lot of people also forget that when you're sick, you often have to delay your regular medications.
Right. Good point. Very good point. Very, very, very good point. Yeah.
So that's what makes me the most upset because
Totally.
I always check in with my doctor and she says, yes, skip this dose or continue when you feel better.
Right.
And then it's not only am I sick, but now my arthritis and Crohn's is acting up and it's everything.
Totally. That's a good point.
Once again, our episode has turned into a giant vent session, but but like sometimes it's so needed.
That's okay. Anyway, let's see what the CDC says. And I suppose the only thing you can do, I shouldn't say the only thing you can do, that sounds depressing, but always advocate on behalf of yourself, talk to your employer about your condition and see what kind of accommodations can be made. If you're going into an office setting, hopefully there have been upgrades on the HVAC systems. You could always mask yourself, but of course, living in the real world, not everybody works in an office, number one. And number two, living in the real world, there are people who may have bosses who might be judgmental about folks who are wearing masks. Unfortunately, that's the real world. So tread carefully, I suppose, is the best we could do.
Yeah.
But advocate for sure.
Yeah, I know it could be scary and intimidating when it seems like everyone's moved on and
yeah.
But like it's your health and like try to do what makes you feel most comfortable. All right, Stephen, what'd you learn today?
I learned a lot about the quick poll regarding clinical trials. I thought that was really interesting, how many folks have not been approached. I think that you and I anecdotally said we have not been approached either, and I think that certainly shows that there's a large cadre of patients out there who could be approached. I certainly would be interested if there's a new therapy on the horizon that might be beneficial. I would want to get in line for that. So hopefully something can be done to change that.
Yeah, those results really surprised me too. But also, it was just good chatting with you, clearing up some of this, like what we know and don't know about COVID and the new guidance that may or may not be coming out.
Yeah. Well, we hope that you learned something too. And before we go, we definitely want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
And if you have any questions, comments, episode topics, just want to say hi, you could email us at podcasts@ghlf.org. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.